I grew up as normal as anybody. I had two loving parents. I didn't go in there asking to be hooked on drugs. I went in there for a car wreck for back pain. The addiction just came out of it. A lot of these people that are hooked on drugs, pain pills and stuff, doesn't necessarily even come out of a depressive state or something like that. You could have had your wisdom teeth taken out. You could have had a sports injury. I was prescribed 150 hydrocodones a month. One script of that and you're hooked.
In the last couple of years, we've lost over 100,000 people to a drug-related overdose. I don't look like, someone that may have a substance use disorder, but that's just the point, that it does not discriminate, and it can look like our moms, our grandmas, our sons, our daughters, our police officers, our judges.
I never imagined how this would be the most rewarding work I've ever done. So integrated healthcare really is a comprehensive approach to medical care.
In reality, most people go into medicine, from my point of view as a physician, most people go in to help folks. And usually, no matter what their health problem is, whether it's addiction, whether it's pain, whether it's hypertension or diabetes, just giving a pill is not enough. Integrated care really means utilizing different health professionals to really work in their area of specialty to help someone be successful.
Even the most simple of physical complaints can really be a pathway, a door opening into something else.
I've been withdrawn pretty hard.
Okay.
I got back on opiates again.
Okay. And that doesn't mean that all of my patients that come in have a mental health or substance use disorder, right? The person may come to me first because they really do want help with diabetes or their annual checkup and stuff like that, but part of it's that relationship that you build so that whenever there is a problem, that they know that they can turn to you.
Very commonly, as we talk about medical professionals working with behavioral health professionals. But in a lot of my work, it also involves physical therapists, occupational therapists, peer support specialists, social workers, all kinds of folks to work with our patients to help them have the best outcomes. I've been working in this area a long time, so it's not really new, but obviously it's taken a long time to catch on because it still doesn't happen everywhere. There's still a lot of separation. There's a lot of things we need to work on to help this work better.
People have very fragmented care, very specialized care that happens. And so a lot of times you have a whole bunch of people working in silos, sending reports back and forth to each other, which always gets lost in translation, right? When you have integrative health care, you get more of that comprehensive, that understanding everything that's going on with somebody instead of a slice of what's going on with somebody. That really makes the difference.
To have that medical home, that center for that patient where they can come and get a wide variety of services, they can receive that all in one place. And when they have that and they see that whole comprehensive approach, they really feel loved and cared for.
People should come to the hospital when they're hurt or when they're sick and when they need help. And we, as a medical community, should be ready to provide those services for them when they're asking, because that window of time from asking is very, very short. And if we don't capitalize it, or if they're met with, well, here's some discharge paperwork and some numbers, here you go, like, that's a lost feeling. That's a overwhelming feeling.
Almost all the years I've done this, I've worked in an integrated setting, and for the first 20 years, that integrated setting was having my wife as a behavioral health specialist right next door to my office, using the same medical record system. And my patients that came in to see me, most of them knew her because they've seen her, as she came out to get people in the waiting room.
It could not be easier. I mean, it's so simple. They don't even have to leave the exam room. So when it's fully integrated like that, I slip into the exam room and I say hello, and I might just talk for 5 minutes. And then maybe we set up an appointment, maybe I just give them information. But it really does cut down the hassle factor.
ERs are a great example where they've seen that outcomes are so much better. They have so many fewer people coming back, less time in the hospital if they can start off with behavioral health people involved from the beginning.
In 2022, we had a counseling student come to the office 3 days a week as a part of a program between UALR and Blue Cross, and we were able to have her here for the year, and that was the most consistent I've had an integrated counselor here in the office. And she graduated in May. We get a new student starting in September, and my hope would be that I could have somebody here 5 days a week because the need is there. I do see it as the future pathway for really treating our patients from a whole person perspective. Because it does help patients and it can reduce cost, that's the direction that this is heading, and I want to be on the front end and not the back end.
If somebody comes in and tells me that they have a headache, there's a lot of different ways that we can address that, right? I can just write them a prescription. I can tell them to do a less stressful job. But they will keep coming in for that headache a lot of times if I really don't get to the source of the problem. So being able to take more time and say, well, tell me what's going on with your life. A lot of times we will, as the saying goes, peel back that onion and learn the real source of what may be causing that, which may not be little sleep or stress and stuff like that. We may be able to find they're in a traumatic situation. Maybe they actually are in an abusive relationship. And a lot of times we put a Band-Aid on it instead of getting to the root of the problem.
Behavioral health is one of those areas that really does just have huge difficulties with wait times and insurance and all different sorts of barriers that can really seem insurmountable to people, especially everyday folks that, go about their life, go to work, do their thing. It's estimated that 40% of patients with anxiety and depression never seek any help for that. 40% is a lot of people.
Behavioral health affects physical health, and likewise. So it's just a wonderful thing to have in our clinics.
There are literally counties and areas of the country that have no therapists, that have no psychiatrists, that certainly don't have people who practice addiction medicine. If you want some help, but you live in a rural community and you haven't had access to internet the same way, and the closest therapy visit to you is 45 minutes, an hour, hour and a half away, your likelihood of going and getting that help once a week, once a month, or anything else like that just doesn't exist. You're more concerned about putting food on the table, to making sure that your family is okay and taken care of, that the bills are paid. And so there's all different kinds of barriers. Some are societal, as far as opinions, stigma, different things like that. Part of it is the simple insurance barriers or financial barriers, resource barriers that exist for people to be able to access the care that they need.
At every clinic, there is access to behavioral health. You can see a psychiatrist, a counselor, social worker, primary care provider, and it's just all, in one location, and it makes it easier for the patients. Before, we've had the integrated care when people had traumatic events in their lives and needed counseling. Our providers are medical providers, they're not counselors. We'd have to refer them out. We've just seen so much success from this program. In the end of 2022, we served over 22,000 patients. We were looking this morning at how many people are in our behavioral health services, and there's probably a quarter of our patients that seek, behavioral health services in one fashion or the other. I'm so happy that we can help people with their with all their needs, and if a quarter of our population are seeking mental health treatment, then, that's probably in every area of the state.
So in DeQueen, we're an hour from Texarkana. And nobody wants to drive to Texarkana if they don't have to. Of course we have to for the surgeries or the heart doctor, but if we can bring something here to town, maybe even, especially to our office, it feels like you're getting that hometown care, and that's what people want. It's allowed me to bring a counselor into the office and have somebody here inside our doors so that when a patient needs, I can do what's called a warm handoff. I had a patient who I was treating with medicine for anxiety, really wasn't getting anywhere, and it was really through having a counselor here in the office. I hardly see this patient anymore because he's been treated or healed, you could say, and that was because of having a counselor available in the office for him to start seeing. We are trying to save costs and improve healthcare, and so if I can keep somebody out of the ER for maybe a medical emergency for anxiety, say a panic attack. You know, a lot of people with panic attacks think they're having heart attacks, and that's the panic attack or anxiety is the number one reason for chest pain ER visits outside of people having actual coronary problems. And so when I can cut down on an ER visit or a hospital admission because of integrated care, then we're improving healthcare and saving money, and that's the goal.
We have incorporated the telehealth carts in all of our clinics where patients can seek counseling. If there's not a counselor on site, they can sit down in a private, comfortable room and have a counseling session with a provider at another one of our locations. So it's very convenient, it's very confidential, very private, and it allows our providers to treat the whole person, not just the medical issues.
Not only were we looking at our patients who were depressed or anxious, but I realized counseling also could help with our patients dealing with obesity, patients dealing with possible drug use or alcohol use, and so it expanded my vision of what a counselor in the office could do beyond just your standard depression or anxiety.
Say you do work in an emergency room and you don't have any behavioral health people on location. You know, you see somebody that comes in with addiction, maybe they've overdosed, and you work medically to correct that overdose and to rescue them. Now they're gonna live, but if they go back home, they're gonna go right into it again, they're gonna overdose again, they're gonna show up in your ER maybe the next day even. If you have a behavioral health person that can come into the room and see them right there, you know, that's gonna arrange follow-up visits, you know, where they can go even the next day to get continued care for this problem, to help reduce the incidence of them having a significant life-threatening event again. When you have a setting that's not so integrated, where they have to go to a whole nother location, maybe another practice or someplace that doesn't share records, you add in an extra step there that gets a little harder for people to do that. So we need to be working with these other folks if we're going to have better outcomes.
Before we've had the integrated care, we were not able to treat the whole person. So if a person came in with substance use disorder, we would have to find somewhere for that patient to go. Transportation was normally a barrier for that person, so they didn't make that appointment. They went without treatment.
For me, integrative care is also about using peer recovery support services.
Peer support's been around for a long time, probably since the early 2000s, just not here.
The originators of the Alcoholics Anonymous Big Book kind of, you know, outline this idea of one alcoholic helping another.
Peer support people are really important because, you know, they've already walked this road.
My freshman year of college, I got a prescription of oxycodone, and I got 2 refills, and I just remember falling in love with these pills. The euphoria they gave me, the sense of confidence they gave me, I felt like they helped me study better. Well, fast forward through college, it rapidly progressed to just taking pills, to snorting pills. I've moved on from pain pills only to heroin and other types of pain pills that you can inject. Over the course of 4 or 5 years after college, it destroyed absolutely everything in my life to the point that I was homeless.
What makes a peer so effective when working with somebody is the connection, the instant rapport that we have.
When we're in a hopeless spot and we've tried over and over again different things, maybe our parents told us or a judge told us, or we had a CPS case open against us, we're trying to fight for our children. Oftentimes it's helpful to have someone that is none of those things, but that speaks the same language as you, that looks like you, that's been through the same challenges as you've had, but have also found themselves out of those challenges and living a new life.
Whenever you walk the same path as them and they know that, they're willing to listen to you. They're willing to listen to you because what I'm telling you is, hey, I might not know exactly what you're going through, but I know what it's like to be strung out.
I eventually hit a rock bottom where I was in a drug-induced psychosis and had to get dropped off at a homeless shelter. Then I was quickly transported to a local hospital where they had to tackle and restrain me and finally get me up to the psychiatric ward for detox. I went back to that homeless shelter and joined a 12-month faith-based recovery program, and it really took an entire community rallying around me to help me get to where I'm at today.
It's so much easier for people to recover in the full sense of the word when they not only have like medical support if they need that, they have a peer support specialist they're in a relationship with, they have a therapist, they have recovery programs. So the fuller we can make that team, the better people do.
There's some medications that I can give patients that are miracles for them, that can make them dramatically feel better and greatly increase their chance of recovery. And in particular for people with opioid use disorder, people that are addicted to opioids, they're injecting heroin, they're injecting fentanyl. I can give them a medication that will take away those cravings, will block the effects of the other drugs, will help them feel normal again, and greatly increases their chance of successful recovery. But oftentimes their lives have become chaotic because of their drug use. And now maybe they're homeless, now maybe they have a coexisting mental illness that drove that addiction to start with. They've alienated family members and friends, they've lost their jobs, maybe now they have a criminal record that's going to interfere with them getting employment. So they have all these other issues that are going on. And as a physician, I've had no training in how to treat that and how to work with them on that. So I definitely need somebody to help me with that. It's going to make them more successful in their recovery. As they're more successful, they have less visits with me. It means fewer phone calls to our practice to help with whatever's going on. As their life gets more stabilized, they do better. And other addictions, say alcohol use disorder, there's some medications that I can give that help those a little bit, but really they need somebody else that's working with them to change many aspects of their life, their social situation, their triggers as to what causes them to drink, what they do when they have cravings. They need somebody to work with all these other aspects of their addiction.
Everybody says they're done when they're locked up. They're done, they're tired of living this way, they're tired of doing this, but when you cross that threshold and you have the opportunity to make your own decisions, you'll find yourself right back there without a recovery program. In order to go through the peer training these days, you have to have 2 years of sustained recovery, of complete abstinence from any minor mood altering substance. That's illicit drugs, marijuana, or alcohol. You got that, you have a high school diploma or a GED, and you don't have any violent charges, then you qualify to go through this training.
About 2 years into my recovery program, I heard about peer support and peer recovery specialist was getting started for substance use in Arkansas. So I went through the training and within 3 months got hired and started working at UAMS in the emergency department with people that had drug and alcohol issues or were overdosing, and I would work with them right from the bedside, providing them with support, whether that be just emotional support and relating to them and sharing my story and encouraging them, or practical support, like if they were ready, I'd help them get directly connected to detox or treatment centers, whether that be long-term or short-term or outpatient programs or meetings, or if nothing else, they'd walk away with 2 doses of nasal spray Narcan, which is the medication that reverses the effects of opioids, and my phone number. So if they, down the road, they decided enough was enough, they could always call out and have someone to talk to that was non-judgmental, that was not going to give them the shame game, that was not going to do any of that. They were going to be welcoming, loving, and helpful. And so that's happened too many times than I can count.
Someone that comes out of an overdose and doesn't have someone to talk to like that might be thinking I've got a problem, but a week goes by and they say, maybe I don't have a problem like I think I do. And they talk themselves out of it, they go right back to it. So having a peer at those pivotal moments is extremely important.
It's a non-clinical role, so it doesn't have that clinical feel to it. Whereas other positions, by their code of ethics and stuff, they can only do so much. But I would follow these individuals after they were discharged and continue to help them. If they completed detox and residential, but now they need sober living and recovery housing, well then I would help them find those connections, because as a person in recovery, I'm familiar with all these resources. You know, more than likely I know somebody that works at those places, and so instead of them cold calling and trying to figure out, you know, what to do, they would call my friend and say, hey, Kyle gave me your number, and instantly that would make their process more simpler. Peer recovery specialists have a unique ability to make a connection with someone. Unless your clinic or your hospital is running perfect when it comes to this, why not try something different?
There is a real stigmatization that exists with medical providers, right? In emergency rooms, there's lots of times that we have labeled people that come in often, right, with different issues. Super users, frequent flyers, right?
You know, what I hear from providers is, well, I don't want those patients in my practice because they've had bad experiences with people with addiction in the past. But the reality is those people are already in your practice. And if you identify that problem, you can start them on medication that'll change their life that very day. You can do it, you know, immediately, and it's very safe, it's very successful. But we fight that stigma. So we still don't have nearly enough providers that are prescribing these medications to their patients.
People that say, I'm not going to accept the referral for that patient because they're on buprenorphine, or that patient has allergies to these kinds of psych meds or these kinds of medicines. They'll say, I already know what kind of person that is. And to me, that is horrifying that we have medical providers, physicians, that would say those things, even if they think those things, that they would say those things and not have a better understanding of the disease concept of addiction, a better understanding or respect for us as providers, whether it's primary care or with me doing integrative health care, that these people need help. They may need help for their broken wrist that needs a plate, and if they happen to be in recovery and happen to take Suboxone because Suboxone is part of their treatment plan that helps them be well, then why would you not accept them as a patient that needs a surgery for the wrist, right? We're already taking care of their substance use problem or their pain issues or things like that. They just need a surgery. We've gotten that. And so, you know, part of that then becomes the outreach to try to educate our colleagues, you know, continue to try to see if they can be involved, or to not refer cases to them if they're going to discriminate against our patients that we've worked so hard with to overcome all of those challenges. There is not anybody that I know that doesn't have something at some point in time in their life. Now, it may not be a substance use issue, it may not be mental health, but everybody has something that happens to them, whether it's a trauma, whether it's a loss, whether it's an addiction, whether it's a mental health disease. Part of the reason that I set up my clinic the way that I did is that I wanted to be able to provide an environment where there was no stigmatization. When you come in our doors, whether you're coming for a primary care visit for hypertension or diabetes, whether you have a mental health issue that's going on where you need assistance, or maybe you're coming because you're ready to get some help for your substance use disorder. Whenever you walk in our doors, nobody knows why you're here whenever you walk in, but you know that you have a place that you can come that is a one-stop shop, that we will understand your needs, be able to assist you immediately, and be able to help you through those different changes that occur in life.
Yeah, I think going into this, I just wasn't as interested in treating people with substance use disorders. And so by being a part of the ABIN, or the Arkansas Behavioral Health Integrative Network, it's just opened my eyes to the need that there is. We have a big need in Southwest Arkansas, you know, all over the state and all over the country. We have a need for that. But I think there's been a stigma from providers, especially to step into that realm of treating people who've had use or abuse, as it might be referred to. And so it's changed my perception of that and opened my thought process to trying to help these people. I think there's the bias or the stigma is that these people choose to be there, and a lot of them don't choose to be there, and they need help getting out of that hole that they're in. And that's, I want to help, I want to help these people get out of that hole.
Stigma is the biggest barrier to treatment. This could be anybody's son or daughter. When we approach someone that are having these issues, we need to treat them the same way we would want anybody to treat our son or daughter. And that is not like, making them feel terrible about themselves because of the, the decisions that they made, and recognizing it as a disease, a brain disorder, not a moral failing or anything like that.
As an addiction medicine specialist as well now, I work with residential treatment centers besides the courts or in our own outpatient practice and things like that. And what we ask of patients in recovery, we ask them for honesty, openness, and willingness, right? So what I would say to my medical colleagues out there are people that just are not sure how they can get past how they feel. I'd ask the same, right? If I can ask a person who has reached their bottom and I say, listen, let's be honest, open, and willing, we will help you get there. We will help you overcome the barriers that you have. I would ask the same of my medical colleagues, and I'd say, listen, be honest with me. Tell me what your issues are. Be open to some new ideas, and be willing. I think with any problem that we face, whether it's personal, whether it's community-based problems and things like that, with those simple instructions, there's so much that we can work through together.
Since we've implemented, one of the things we see is just this complete change in the company culture. The level of buy-in is pretty incredible.
Employees learned from this that, there's a ton of people out there that but you had no idea that they needed these types of services, and it helped change the way they feel about people they don't know, that they would look at and judge. Providers that would say, previously, well, I really don't want to see that patient, they just want some meds. Well, now it's changed their outlook. It's like, okay, they want some meds, but why do they want some meds? Let's dig a little deeper and get them into behavioral health and see why they want these meds and get to the root of the problem.
I guess increase my satisfaction with the work because it's not just me doing this. I now feel like when you're part of a team, you get multiple inputs. I guess you get different ideas. I think one way, and a counselor may think a different way and have an idea that I hadn't thought of. Just like this patient that I was able to get connected to my counselor, my medicine wasn't working for him. My treatment wasn't working, and it was the counseling that helped get this guy fixed. And so it's situations like that you realize that, hey, there is more than one way to treat disease, and we know not everything works the same way, but by having someone here, it gives me that confidence that I have another route to help people, and it's not just relying on me alone.
All of our providers get together on a regular basis, medical and behavioral health. We get together and we talk through things, difficult cases. What can we do here? How can we make this flow better? Recently, some of the docs came and said, hey, will you help us? We're having trouble talking with patients and really figuring out if they really need therapy or if they don't need therapy. Like, how do we kind of cross that and say, let's make a really good decision here? Is it the right time? Is it the right, method of treatment for you? And so we worked together and came up with some tools for them to use. So when they're seeing a patient for their blood pressure, or their blood sugar, or maybe even an ear infection, they can talk about these things.
It's about connecting somebody with mental health. It's about giving them a list of meetings and offering them some people that can help them go in case they don't have a ride. I know that the best way for you to be successful is for me to give you all the tools. Why would I just give you a diagnosis and one tool, right? Why would I not give you every opportunity?
It's not uncommon at all to have, a message from a medical provider that says, I have this patient, I know you see them for anxiety, their blood pressure is really elevated, can we work together? Patients will come in for that follow-up with their medical doctor, and they'll say, okay, how's therapy going? What are you working on with your therapist? That's a connection to that physician that the patient really craves. We crave that connection with others. There's not a lot of places where you can see that happening.
Being able to integrate that into all of our clinics, I couldn't ask for anything better or fulfilling to know how many people you're helping and to see the success of so many patients that would not have ever, gotten these services without us providing them.
It seems like whenever I went through med school and training and over the last several years, it has become so industrialized in a way that you're afraid to not meet this metric, or you have to have so many you get through because of insurance reimbursement rates or stuff like that. But what this has shown me is that I can, as I say, practice medicine the way I want to, do some real good for my patients, and as far as being worried about can I make it in that kind of model, absolutely. And each year it is improving. It's just a matter of having a want and a willingness to be able to sit and serve those kinds of patients in a different model.
As administrator, one of the things that I have to look at is financial sustainability. We have grown significantly, and one of the reasons that we've been so successful is because when patients come into our medical clinics to seek behavioral health services, it takes away the stigma of patients coming for mental health reasons.
We have a psychiatrist, we have 5 psych certified nurse practitioners, and we have 6 therapists, and we also have 6 care managers or case managers that help to, I say they're the glue that holds us together. So they really coordinate a lot of communication between the patient. They're kind of the go-to for the patient, and they help manage appointments and services and things like that.
Nobody has any idea who they're seeing. They don't know if they're seeing a medical provider or a behavioral health provider or a social worker for counseling, whatever. It takes that stigma away. Being a nonprofit, I try not to focus so much on that, but I have to focus on the finances. So, it has been some hurdles to jump over, but that all, I think, is being resolved by getting people into the right roles who have experience that know how to bill for these services. If you have, trained individuals who know your coding and, how to bill for these services, then you'll get reimbursed. We're seeing a big difference, and, financially it's going to be sustainable.
We knew that over time, if we just did the right thing for our patients, that it would pay off in the long run, and it definitely has, both financially and rewarding and ensuring better outcomes for our patients.
It's just such a whole service for our patients that we can provide, and it is just been one of the things that I've been most proud of, is being able to expand this integrated care to all of our clinics.
I think there's clearly a case for healthcare in general. It will decrease utilization. There's societal benefits also. You have fewer people that are getting arrested, fewer people going to jail, fewer families that are breaking up. So I think there's financial benefit on all different levels, from the practice level up to societal level. 10 to 15 years down the road, there will be a lot more people doing this. I think this will be this, I think it's probably almost the standard of care now.
The only change I would make is having started earlier.
There's all kinds of different levels of integrated care, and I think it's important to realize that, you don't have to employ a social worker or a behavioral health specialist in your practice to become integrated.
My advice is always do one thing. Do one thing. Maybe you can't offer the full range of services that we can offer, but can you maybe form a relationship, a partnership with a counselor, where maybe you can get your patients in sooner? Or maybe you can't even do that, but maybe you can hire a care manager that can come in and help you screen your patients and help you at least identify those. You know, there's a large majority of patients that come in and see their medical provider in the week preceding when they take their own life. And they're not seen for anxiety or depression, they're seen for high blood pressure or a stomach ache or something, an ear infection, something very, benign. And then within 7 days, they've taken their own life. And nobody has a clue. But if we ask, then maybe we do know that. Maybe we can prevent a lot of those things.
We're really trying to get back to that value-based care for the families that we serve.
We know now that people that have acute severe physical trauma, they're in a severe motor vehicle accident, their risk of developing chronic pain is more related to their anxiety and their depression that they had prior to their accident than it is to their severity of their injury. So if we're going to work on having better long-term outcomes in our major trauma patients, we need behavioral health people involved from when they show up in the emergency room.
Even if it was one thing a month that you started to integrate into your practice, you'll see the immediate changes, and what seems like overwhelming at first really will become very simple. If you are willing to take the time to listen and to hear them and to meet them where they are, then it seems obvious to many providers that this is the kind of care we want to deliver.
Changes don't just affect one generation. Changes affect multiple generations.
There's this ripple effect that goes beyond our walls and goes out into the community and affects so many areas of life for a community, from criminal behavior, illegal activity, driving while impaired, and it goes to families, and children are going to be healthier and less traumatized, and relationships can stay healthier, and people can stay together if they want to. And you have workers who are going to be more productive and safer on the job. I mean, it's this ripples in the water that go way out.
It doesn't require some new costly item or change in the process. It really just requires a change in attitude, and willingness, openness to the opportunity, and a little bit of making some contacts, adding a few CPT codes to what you do. We typically have been driven by systems that are fee-for-service. So, if you come in and tell me you have anxiety, I write you a script for hydroxyzine or something else and say, I hope that gets better. Let me know if you need something else. And I say, I don't, but that's typically how we've been trained to do it, right? We got to meet metrics for employee organizations, for corporations and things like that. And to me, for myself, that's not as satisfying. People ask me, how can you do this as a independent practice without the support of the corporate system? There's a real opportunity as far as whether it's bundled payments, whether it's ACOs, whatever that is, to not only be able to sit and get to know your patients and always get to finally practice medicine the way you always really wanted, but to be able to be recognized for that, because now we get paid for the amount of time that we spend with somebody or the added value in service. Every patient that walks into my clinic gets screened for anxiety and depression. Connecting them with services and mental health services now gets reimbursed if you're willing to do that. And so definitely we have grown so rapidly in just a couple of years that we just finished building a clinic and we're already outgrowing it, right? Because of the number of people we can serve. I can't imagine not doing it this way. No matter where you are, what you do, you have those patients in your practice. You have those families that are in need. I have joy when I show up to work each day. I'm able to make a real difference and to make decisions that I know are right for my patients. I loved watching my dad be able to practice medicine and take care of somebody in the way he thought was the right way. Not because of what some insurance company told him it could be, not because of what some hospital policy was or national metric. He did what he knew was exactly right for that patient. And integrative healthcare lets me do that.